Now imagine this: a mother rushes her child to the hospital in the middle of the night, only to be told she needs to make a deposit before treatment can even begin. Or a father who has worked all his life suddenly falls ill and his entire savings disappear in just one surgery. Sadly, these are everyday realities for many Nigerian families. In our country, falling sick doesn't just test our bodies, it tests our pockets, our dignity, and our ability to provide for our loved ones. While the government has rolled out subsidized healthcare services and health insurance schemes meant to ease the burden, many Nigerians still find themselves paying out of pocket, borrowing money, or selling what little they have just to settle hospital bills. Some even delay or abandon treatment altogether simply because they cannot afford it. Now, this morning, we want to hear from you in our phone-in segment, Subsidized Healthcare Services. How are you dealing with medical bills? Have you been able to benefit from subsidies or insurance, or are you still struggling to cope with the rising costs? Pick up your phones and share your story with us, because beyond the statistics, it's it's your lived experience that truly reveals the human cost of healthcare in Nigeria. Make sure you call us in on the numbers displayed on your screen and send us a WhatsApp message as well. We'd like to hear from you. Your voice does matter. Let us hear your experiences, your story, and what you think about the rising cost, as well as how it has impacted you during trying times. All right, right off the bat, we have our first caller this morning. Hello, good morning, and thank you for joining us.
Yeah, good morning.
Good morning.
Good morning.
This Abdullahi Abubakar calling from Makodi, the connection.
Good morning, Abdullahi. Thank you for joining us. How is Benue this morning?
Benue is so absolutely fine and cool.
All right. Go ahead with your take.
Because 90% of our states, the poor man doesn't benefit from the services of the federal of the government. Because the hospital, you cannot even get paracetamol. Common paracetamol, they must write it for you to go and buy it outside. Common needle injection, needle and syringe, they will ask you to go and buy it outside. Then what are we benefiting from the hospital? Both the medical center, the teaching hospital, and the general hospital. And there's not enough equipment. Anything that happens to you that you are going for test, they will ask you to go to a private clinic, or you go to a private hospital to go and do tests, to go and run your test. What kind of government are we running? Which assistance are the government giving to an individual, especially we the government? No general 100% good services in the teaching hospital and the medical center of general hospital. You find that your child is dying and there's no test to be run to him. At the end, they will ask you to go to a private hospital to go and run a test and come back. And when you come back, the bill at that general hospital or medical center, my sister, I'm very sorry. When they give you the bill, you even try to run away and leave the hospital. So
it is called Kiyawa.
We don't benefit from any of the services. And the drug, some of them that when you want to buy the drug, they will ask you, don't buy it outside, you must buy it inside the hospital. That you must buy it in the hospital because of their interest. So I think I'm appealing to the government, please invest more in equipping a hospital with equipment and drugs, so that to help assist the poor men that we cannot be able. Fine, the government has brought especially we Benue State, that's Benue State National Health Insurance Scheme, which is taking place now, is the one that many of us are registering under it and is helping us. I pray may the Benue State government give him more elbow to continue with this system, so that the poor man will benefit from the services. Thank you very much. May God bless Cross TV. May God bless the two ideas and may God bless Nigeria. Thank you very much. Give us peace.
All right, thank you very much, Abdullahi, for that. Maimuna, what is your take when you there are lots of people, especially like yesterday we discussed on, the subsidy on dialysis, and you would see there are different aspects when it comes to healthcare, when it comes to illnesses. People would go to the hospital, they would fall desperately ill, but then at the end of the day, due to the cost, it would be, the cause of their death, due to the fact that they do not have the funds to pay for those treatments. So what is your take on allowing or having a way in making sure that those people that cannot be able to, pay for that, for them to get a subsidy when it comes to medication and treatment as well?
We have Ade on the line.
All right, let's pick Ade.
Good morning, Ade. Thank you for calling in this morning.
Good morning, Maimuna, how are you today?
We're
very
doing
well,
fine, thank you.
Please
Good morning.
share your thoughts.
You see, it's very, very sad the way our health services are in it. I'm telling you. Because there are many that have died that are supposed to be alive due to human error. When you go to a hospital, no matter what happens, they should attend to this call. Stabilizing the situation, they are asking to go and bring your family to pay this. But if somebody is dying and you pay the money, or you don't have the tablet, whatever. It's very, very sad. You see? I say one of my friends in was on where I think we go to those states, and she went. She do everything. They write some medicine she should buy. They said, no, don't take it out of this clinic. You must buy it from us. So I go to buy it up there. I spend the money. Because you know what happened? When they see that, they say, buy it again. I end up spending 350,000. I said, don't go there. This one, they are just looking for way to get money. I'm not now, she's trying now. So, many people, when they go to the hospital, you see life and death. Our people should have compassion. And I blame this solely on the government, the federal and the state government. Because the health of people, health is wealth. It's a priority. You see, if you are sick here, you go to a clinic here. My clinic is just about 2 bus stops from my house. You see, I go there, I book on my phone, I go there, and they attend to me. I order my prescription on my phone. So, if your case is not important to us, that to go to hospital, they will not write to your father, and they will attend to you. Even the law that changed now, before anyone can come and give back, that it doesn't work that way. If you allow it to give back, they will everything will be fine. Let us do the bill. If you don't pay the bill, then you that because you're a foreigner. So, but you give everything. Well, it's not like that in Nigeria. The state government should do something about health center. Because local government, I don't think they have the power, but the state. So that our people will not be dying before they attack. Especially pregnant women. You see, that's why I don't know. Whether it's democracy doesn't feel. I don't know. So that's left Nigeria to be done. God bless Nigeria. Good morning.
Good morning, Ade. Thank you so much for calling in this morning. Our value for human life is very, very paramount to start with. And, most of the accounts we have gotten from Nigerians, even I have had, a first-hand experience concerning going to the hospital and not getting immediate attention. Shatima is on the call, so let's speak with Shatima before we continue. Good morning, Shatima. How are you this morning? Thank you for calling in.
Thank you. Good morning, Hauwa. Good morning, Maimuna.
Good morning, Shatima.
So how are you doing this morning?
Oh, very well, thank you.
Fine, thank you. Thank you for joining us. Go ahead with your thoughts.
Subsidized health in Nigeria. Honestly speaking, that is where that is where the subsidy is supposed to go. Because if you look at it very well, the health services in Nigeria are becoming something else, which a common man cannot afford. And now I can tell you, we are praying for all Nigerians to be healthy. God forbid for somebody to fall ill. But we know, as long as you are alive, sometimes you must fall ill. We know that. But we are praying for Almighty Allah to grant all of us health. Because now, if you will wonder, for you to cure a people, you need 50,000 naira. Look at a common call time. The one that we are buying 20 naira today is 500 naira. How a common man will do? You see, and also if you go to the to the hospital, the thing is worse. The thing is worse because the bill that they will place on you, it's hardly for you just to set it. Because look at a hospital bed had become a small lodging. A night, you spend a night, they demand 4,000 naira from you. It's also almost equal with some small lodging. You see, that is the reason why we are hoping and we are praying our government will touch this health sector to do something about it. That is why I was saying, please, we are begging the federal government, state government, to do something about it. Rather, we are praying for God to touch their heart to give free health services to aged people and our senior citizens. I will not be time in making this appeal. Because our aged people, they're supposed to enjoy free medical services and our retirees. Because these are the people that I pity most. And if you look at the way the country is going and how things are becoming expensive each and every day. So we are hoping and praying that this appeal should be considered. Now somebody who is looking for what he will eat and you place thousands of naira for a hospital bill, how do you think that man can cope? It's very difficult. It's very difficult, sincerely speaking. And the worst part of it, we are lacking a balanced diet. Even simple meal that you will eat, it is becoming something else. So talk less of the hospital bill. So it's not easy. It's not easy. Now today, if you go to some teaching hospital now, for you to see a doctor, you have to place 2,000 naira for consultation fee. And if you come back tomorrow, another 2,000 naira. Yeah, we are not printing the money. And this country is belongs to all of us. What will be given to Mr. A because he have privilege in the political office holding? It's supposed to be given to Mr. F. Because Mr. F is also a Nigerian. But this unfair treatment, this unequal treatment, that is why we are just having problems. If a Niger can give an 8% free health services, why not Nigeria? I do not see the reason why Nigeria cannot give. And Niger is giving free health services to an 8%. They look at the criteria. What age will be suitable for them to be enjoying a free health services? We are calling our government to consider this, please and please. That is the only thing that our aged persons and our retirees, they will feel that they are part and parcel of this society called Nigeria. Thank you so much and have a nice day.
Thank you very much,
for calling
Shatima,
in.
for that.
Now, Hauwa, there are some hospitals, some federal medical centers and also government-owned hospitals that have, a scheme. And it works just like the NHIS, where you have your health insurance. All you just need to do is walk into, that hospital and make inquiries. I think it has to do with, it's called a basic minimum package of health services. I know that of Gwagwalada Specialist Hospital, where you have to pay a subsidized amount to be registered under that scheme. And then each time you want to access medical care, you go to the hospital and then you get it at a subsidized rate. I feel Nigerians need to be properly informed about all of that. Yes, about all of that.
All right, let's take our next caller. Hello, good morning, and thank you for joining us.
Good morning.
Good morning.
Thank you for joining us. What is your name and where are you calling from? All right, good morning, Tony Izzy. Thank you for joining us.
Thank you so much.
All right, go ahead.
Well, it wasn't easy for us to invest. No, I know it's necessary.
Okay.
It wasn't easy. If you want to, for you to private sector. When you go in the private sector, then go to government hospital. Just as everything is go outside. And if you want to get all this attention, some of the medical doctors, they have their own private attention. So it wasn't benefit from there. We are not asking too much. Just give us a little facility that will keep us going. But in terms of government, they are not trying in spite of what good morning.
All right, thank you very much for your contribution. So, Maimuna, as you earlier said, there are lots of things that have been put in place, especially the schemes that could aid people in getting subsidies when it comes to their healthcare. But I believe a lot of people are not aware of it for them to even inquire and, make use of that scheme. And that in itself is actually detrimental because, those services are provided, but then people do not enough people know about it for them to, make use of it and for it to be helpful towards their healthcare.
Absolutely.
All right.
We have another caller on the line. Hello, good morning. Thank you for calling in.
Yeah.
What's your name and where are you calling from? Good morning.
Beautiful presenters.
Good morning.
My name is Abakar calling you from Gwagwalada.
Good morning, Abakar.
Good morning to you. It's very unfortunate with the current economic situation when majority of Nigeria live from hand to mouth. Mostly people can hardly save for emergency. So it is, and the cost of living is too expensive. And the health sector is not being subsidized. A lot of Nigeria, recently we are recording deaths among the populace. People are languishing in sickness at various homes because they cannot access costly medical care. I could remember what made the former American President, Barack Obama, the darling of American citizens. It was because during his time, he introduced Obamacare, a subsidized medical care for the downtrodden, to the tune of millions. If you are down with sickness and you are downtrodden, you can access medical care free of charge. But here in Nigeria, subsidies they have removed subsidies on petroleum, on electricity, on education, on healthcare. And if you don't have healthy citizens, then you have unproductive citizens. You have sick and weak citizens. I don't know the kind of government we are pursuing, the kind of policy they are running. If your policies and social reform is not to empower people, is not to feed them, to keep them healthy and treat them properly. It says a lot about your program. Please permit me to pass information on Babalada High Agri on the highway. It was already blocked by the truck drivers. So most of the innocent travelers and commuters are trekking long distances to leave the authority concerned to save the situation. That is my take. Thank you.
All right, thank you very much for that, Bakar. All right, when we're looking at this particular situation, it is quite sad to know and understand that a lot of people go through, desperate times whereby it takes them to an extent that it leaves them. Leaves other people in debt. It leaves other people in should I say, more poverty than they were
before,
yeah, exactly, due to the fact that they need to treat those illnesses. They would probably borrow money, or they would have to sell off some of their assets. Yes, absolutely.
We have another caller on the line. Hello, good morning. What's your name and where are you calling from? Good morning.
Yes, good morning.
I'm calling. I'm AA Combo from the ancient city of Nupe Kingdom.
Good morning. Thank you for joining us.
Thank you. I'm greeting Ajahn that are in the studio.
Good morning.
Good morning.
Health is wealth. Physically, mentally, morally, academically, spiritually, health is wealth. Well, with temporary government, the time when decided they created insurance for health insurance is good one. You should go down to the local government and other states. You see, the rate of medicine buying in the federal medical center is too high. But they are trying because they have drugs. But tuberculosis, they have free drugs for HIV and others. They are trying that federal medical, but the bill should be reduced. What especially people come to deliver. Federal government should assist people with drugs for anti-snake bite. It is 40,000 naira to 70,000 one drug for anti-snake. So we are wishing Nigeria the best of luck. Most especially general hospitals are trying delivering maternal maternity. But the government again should increase the salary of the nurses and the doctors. And they will take care of the retirees. Nigeria will grow. And the federal government is serious, but one day we are going to compare ourselves to America and Great Britain. Long live Nigeria, long live health sector. By achievement, Umar Kudu is to pretend, of course, to retire from a Congo family in Peter in Niger State. Thank you very much. Thank you very much.
All right, thank you very much for your contribution. I believe we have a couple of WhatsApp messages, right, Maimuna?
Yeah, we do have a couple of WhatsApp messages this morning. Please keep your messages coming in. We're going to read it here live this morning. Okay, we have another.
All right, before that, yes, let's pick our next caller. Hello, good morning. All right, we lost that call. Let us move straight to the WhatsApp messages we have. We have one from Abdulrahman Amin. He says, good morning, Daybreak team. On the issue of medical bill subsidies, the realities on ground is that many Nigerians are still struggling to access affordable healthcare. The rising cost of living has made even the subsidized charges difficult to cope with, leaving people to ask, how do we afford medical bills in this economy? Another big concern is that most of the government hospitals where the subsidies apply do not have the basic equipment, drugs or manpower to attend to patients. In many cases, patients are referred back to private hospitals for even the simplest tests or treatment. This makes the subsidy look good on paper but almost ineffective in real life because people still end up paying high bills in private facilities. Now, if the government truly wants the subsidy to be effective, it must go beyond reducing charges and focus on equipping public hospitals, ensuring the availability of drugs, and strengthening manpower. That is the only way ordinary Nigerians will feel the impact and truly benefit from this policy. God bless Nigeria. Thank you very much, Abdurrahman Aminu, for that.
I keep your messages coming in this morning, and kindly share your thoughts on on the topic. Excuse me. We have another message this morning, quite a lengthy one, but then we'll dig in. We have a message from Edward Okumoya, and it says subsidized healthcare is supposed to reduce the burden. Okay, subsidized healthcare is supposed to reduce the burden of bills on ordinary Nigerians, yet the reality is different. Statistics show that Nigerians pay 75 to 76% of healthcare costs out of pocket, one of the highest rates in the world. Government health spending is less than 1% of GDP, far below the Abuja declaration target of 15%. This means public hospitals still pass most of the financial pressure to patients. For households battling non-communicable diseases, the strain is even heavier. Okay, continue from there. From households battling non-communicable diseases, the strain is even heavier, averaging 122,000 naira yearly, with about 30% of households experiencing catastrophic health expenditure. Dialysis treatment, a life-saving intervention, costs 40,000 naira per session and up to 2.7 million naira annually. Sadly, 98% of patients pay entirely from their pocket, making it nearly impossible for the average Nigerian to survive such conditions. Meanwhile, insurance coverage remains very low. Only about 9.5% of Nigerians are covered under any scheme. Even though the NHIA Act 2022 and state-level programs like Ilera Echo in Lagos and OHIS in Osun are steps forward, they are still exceptions rather than the rule. So the big questions are subsidies truly reflecting in the reduced bills Nigerians pay, or are corruption, poor monitoring and weak systems eroding the impact? How can government ensure that funds do not disappear into bureaucracy but directly relieve patients at the point of care? Subsidies must not exist only on paper. They must translate into cheaper treatment, broader insurance coverage, and reduced out-of-pocket spending. Otherwise, millions of Nigerians will continue to be pushed deeper into poverty by medical bills. That was quite a lengthy. Thank you for sending in your message this morning.
And the detailed statistics as well. I don't think we have more at this moment, okay. But then at the end of the day, as clearly been stated, that this subsidy is being needed and other policies need to be put in place when it comes to making sure that those that are more vulnerable are taken care of, especially when it comes to, let's say, maternity, when it comes to mothers giving birth, due to the fact that there's a high rate of maternal mortality, and aside from that, terminal illnesses as well. And then look at retirees as well as old people. And aside from that, we have to look at, as I earlier said, those terminal illnesses, because when it comes with that, it is something continuous that would drain a lot of people when it comes to funding. And with absolute certainty, if the healthcare system is reshapen and the equipment and facilities are right on track, then everything would really, really be easier for Nigerians at this particular moment.
And the government needs to, put out the strong measures, when it comes to regulation. Most of these hospitals, for example, the government hospitals that give free antenatal health care, cesarean session, I think some hospitals do free, or there's a certain percentage you get to pay as a patient, and then the hospital, completes the bill. But there are some hospitals that already have this, free, should I say free or subsidized medical services. But at the end of the day, patients don't get to access them. So the government need to get, a very strong regulation, monitoring. They need to monitor the department in charge of giving certain percentage or subsidizing these healthcare services to patients, because at the end of the day, you cannot come up with a good initiative and it's not getting, across to the people that really deserve it. So I think they need to monitor strictly hospitals where they know that people can access this subsidized healthcare should be monitored closely. It is very important. Sometimes you hear patients saying that, we heard that syringes, drips, and some certain medical equipment that are supposed to be used is free,
meant to be given for free. Yes.
But at the end of the day, they get to buy these things outside of the hospitals, and they go to pharmacies that are, their drugs are a bit expensive, and, they're stranded at the end of the day. So what is the point of subsidizing this particular healthcare and the people are not getting access to it? You need to ask yourself, are we really doing close monitoring to ensure that the reason why we started this initiative in the first place is being achieved?
Because as you mentioned, close monitoring is very, very important. That in itself is very detrimental to the healthcare system due to the fact that when it comes to things that are being provided to be used for free and then they are not being given for free and they're sold to them, some hospitals you would see that those materials that are being provided for them to be used, they sell them to the patients, which is absolutely
outrageous.
Outrageous, absolutely. Yes. Because, and then at the end of the day, as one mentioned, that when prescribed medication, you would have to buy at the hospital's pharmacy, even if you could get it at a cheaper price outside the hospital. But then those factors that are surrounding, not being able to get that proper subsidized healthcare or affordable healthcare here in Nigeria need to be really analyzed very, very well in depth.
And then I'm talking about, emergencies running into the hospitals, and then they say, okay, you need to deposit a certain amount of money before most especially accident victims. We've had lots of reports concerning that people go to the hospitals that, had an accident, and then the next thing is bring a police report. You need to deposit a certain amount of money before we attend to. We need to understand that every life matters in Nigeria, and we need to take it very, very importantly.
I was quite shaken when you just mentioned it. It just reminded me of a scenario that I saw when I went to the hospital. And due to the fact that they couldn't be able to pay for that initial, treatment, they were all spread on the floor and left there. So you could imagine the kind of healthcare system that we have, and we're hoping that it really does get better with time and measures and policies that are being put in place.
Absolutely. We've come to the end of our interactive segment. Thank you to all of the callers that called in and also sent in their messages.